Hey Facebook, Riley here from One Medical. Have any of you guys ever been confused by all the different types of medical degrees out there? I know I have. So over the next couple weeks, I'm going to be chatting with some of our different providers here at One Medical to find out what exactly all those different letters mean. Today, I'm going to be chatting with May Lin, who's a doctor of osteopathic medicine here at One Medical. But before I chat with her, I wanted to share a little bit with you guys about what exactly One Medical is and what we do here. So for those of you who are members already, I would love to hear what you guys love about us. Just let us know in the comments. So One Medical is a membership-based primary care practice that's designed around you. So that means we have longer appointment times so we can make sure you have the time you need to talk to your provider about everything that's on your mind. We have 24/7 online virtual support. We have world-class providers. We have same and next day appointments that work with your schedule. And we have a whole lot more because we believe that the better that we can know you as a patient, the better we can treat you. So if you'd like more information about everything we do, head on over to onemedical.com. And now that I have told you all about One Medical and what we do, I'm going to start chatting with May. So here is May.
Hi, everyone.
So May, just to get started, Can you just tell us a little bit about being a DO and what that means?
Yeah, so like Riley said, everyone out there, DO stands for Doctor of Osteopathic Medicine. And there are actually two types of licensed physicians in the United States. There are MDs, which we commonly know, and there are DOs, which is my training and background. Mm-hmm. Now, both MDs and DOs go through the same process through education, medical school, residency training. We go into different specialties, such as I'm a family practice physician myself, but I have colleagues who I went to medical school who are psychiatrists and anesthesiologists and surgeons. And so being a DO pretty much means that you sit at every single corner of medicine, just like an MD. But the difference is that DOs have a slightly different approach and philosophy in looking at the human body, and we're going to talk a little bit about that.
Yeah, so can you just tell me how DOs practice?
Sure.
So what can you expect
from a visit with a DO, right? So in primary... The differences are probably more with specialty and less with MD versus DO.
Okay.
So here at One Medical, we're kind of a primary care practice, and I do physicals. I take care of people when they have colds. I evaluate people for low back pain and all sorts of very common primary care sort of situations. And so the visit doesn't really look that much different from an MD. I take a history, we go through your medication list, we do a physical exam, and then we kind of figure out together what might be the best treatment plan. Mm-hmm. The only thing that makes me a little bit different is that I look at the body a little bit more holistically because of my training. And what that means is, one of the philosophies of osteopathic medicine is that the body is a single unit. And it means that your mind, your body, and your spirit are connected. And so when I ask you about stomach pain, and how you're doing with it, I may ask you a little bit more than just your physical symptoms. We go into emotional symptoms. We go into, how things are going for you in your life otherwise. The one added thing that I would sometimes offer to certain patients in certain situations is something called osteopathic manipulative treatment, or OMT. And that's a hands-on treatment to help with different kinds of mostly musculoskeletal, but it could be non-musculoskeletal sort of situations. So we'll give an example of that.
All right, yeah. So in your approach to primary care, what is unique about how a DO approaches primary care?
I think this is probably best illustrated just through an example. So fortunately or unfortunately, a lot of us know and have experienced something called carpal tunnel syndrome. So I just have a little diagram here on the hand. And so what happens is sometimes you're on the keyboard a little bit too much, and you start getting some pain or numbness and tingling in your hand. And what happens is that there's a nerve in your hand called the median nerve, and here's another illustration of it with some wording. Can you guys see that okay?
We can also share the image in the comments after this so that you guys can get all up close and personal with that.
Yeah. So I want us to focus our attention on the median nerve there that runs through the wrist into your hand. And it's actually surrounded by what's called the palmar carpal ligament, as well as the flexor retinaculum. So what happens is sometimes that nerve during carpal tunnel syndrome doesn't have enough space.
Okay.
And traditionally what we would do is, number one, you have to change your position and ergonomics to make sure that, you know, your hand is in, or your wrist is in neutral position when you're typing, so you're not compressing it in a certain way. Other things we might recommend is bracing, sort of wearing a carpal tunnel wrist brace to help maintain that neutral position. But a lot of times what happens is, you know, it's kind of like a structural issue. And there's just not enough space for that nerve to be moved, or that nerve needs to be adjusted with respect to the other parts around it. And so what I can do through osteopathic manipulation, or OMT, is to give a little bit more space there. So can I just borrow your hand or your wrist?
We'll do a little demo.
We'll do a little demo here. All right. So I am kind of handshaking with Riley, and let's just make sure we get your, there we go. Okay. So I'm going to move myself back a little bit so everybody can see nicely. So I have sort of your forearm, and I have your hand, and you have two bones in your forearm, the radius and the ulna, and I can put a little bit of compression there, as well as to move it in order to soften the ligament or the tendinous sheath that connects the radius and the ulna. And so what I do is I give a little bit of sort of movement so that there's less tension in that area. Okay, and your tissues I can feel with my hands, because that's how I've been trained, will kind of have a release, and then it'll have a little bit more flexibility. Okay, so there'll be less restriction there. Another thing is that flexor retinaculum, or the ligament that kind of runs across the wrist that we saw in that diagram, sometimes can be really tight. So sometimes that's due to you being on the keyboard a lot. Another example of it being really tight or not having as much space is when folks are pregnant. So a lot of times with pregnancy, you have a lot of fluid in your body. There's not a lot of space for certain nerves, and it's common for pregnant women actually to get carpal tunnel syndrome. Okay. And so what I can do is to physically make a little bit more space there. So I'm just going to slide my hands in between here, give a little bit of tension here to your wrist, and then open up the space. Okay, so I'm literally, mechanically, opening up the space of the flexor retinaculum.
Yeah, and you can feel
that,
it,
right? Yeah. We're doing our best on camera here, but a lot of times you just have to feel these things. And just to finish up on that, sometimes when your carpal tunnel is really, really severe, the surgeons actually go in and cut that ligament. And so what I do with osteopathy or with osteopathic medicine is just to kind of loosen that restriction. Okay. Yeah.
Very cool. So I kind of got ahead of myself earlier, and I already asked you about what to expect when you come into a visit with a DO. But so if our viewers have any other questions about being a DO or want to do some more research, are there any resources that you recommend?
Absolutely. So we'll also post these on the comment section, right? But I really like to kind of have folks start off at the American Osteopathic Association, or the AOA website, and it's osteopathic.org. Okay. So that's one resource that I recommend if you're kind of new and you want to learn a little bit more about what DOs are. Of course, at One Medical, you can kind of look at our profiles and kind of see which areas of interest DOs have. Now, one thing that I'll say is that I happen to be a DO who really, really enjoys doing osteopathic manipulation, but not all DOs choose to practice it. And so not all of our DO providers offer OMT. Okay. Yeah. There is another resource that I'd like to point folks out to. There's been a recent PBS documentary called The Feminine Touch. And if you get all into, you know, what is a DO and all that, and you get very interested, and you want to learn a little bit more about osteopathic medicine's history, especially as it pertains to women physicians, I would point you to a documentary that's been done. It's called The Feminine Touch. You can find that through the sort of PBS. I kind of just typed it into Google, like PBS, The Feminine Touch, and it worked.
And I can also share the link to that. I know you said there's a trailer, and then there's a full version. The trailer gives you a pretty good idea.
There's like a trailer that's really short, and that's probably a good place to start to see if you want to commit like 45 minutes to watching the whole documentary.
Cool. Yeah. Well, thank you so much for taking the time to chat with me today.
It's my pleasure.
Yeah. And is there, if you have anything else you wanted to touch on? Is there anything else in the last minutes here? Or
some of my patients are really my teachers,
Okay.
And some of my patients will say things like, I wish I had known about osteopathy or osteopathic medicine a lot sooner. In fact, I saw a patient this morning who made that comment to me again. And so I would just say that if you are somebody who has sort of musculoskeletal complaints that haven't been able to be resolved in other ways, or sometimes DOs are called the doctor of last resort because patients have seen different specialists, and they really need somebody who is able to put the whole picture together. I would encourage you to have a conversation with a DO. I'm going to show one last diagram, if that's okay.
Go for it.
DOs are really into and very nerdy about anatomy, and I'm just going to show this diagram about the different layers. I know it's a face and kind of scary, but it just kind of shows the different layers of your body, and we really have a huge sort of respect for anatomy, and you really practice based on our understanding of anatomy. So sometimes, you go to the cardiologist for your heart, you go to the neurologist for your nerves, you go to your physical therapist to help you with muscle strengthening. Who really goes layer by layer and kind of looks at all those parts together? Well, I kind of think DOs do, because we do sort of like a holistic approach to looking at the human body. And so if you ever feel like that's something that can be helpful for you, just encourage you to consider seeing a DO.
Awesome.
Yeah.
Well, again, thank you so much for chatting with me today. And if any of you guys have any questions that we didn't get to about DOs, feel free to leave those in the comments and we will answer those for you. We also have more information on onemedical.com and onemedical.com/blog, and I will be sharing all those great resources that May mentioned earlier. So thank you guys for tuning in, and I will see you next time on Facebook Live. Have a great rest of your